Welcome to TCM Board Formula Series. Today we review Zhong Yi Qi Tang, Tonify the Middle and Augment the Qi Decoction. It belongs to the category Tonify Qi and Raise Yang. The fastest memory hook is this: Tonify the middle, then lift what has sunk. By the end, you should recognize the core ingredients, formula hierarchy, pattern picture, major differentials, and modern safety checks. This lesson is for board preparation and professional education. It is not a diagnosis, prescription, or substitute for individualized medical care. Build the formula from its ingredients. Huang Qi, strongly tonifies Qi and raises Yang. Ren Shen, reinforces source and spleen Qi. Bai Zhu, strengthens the spleen. Zhi Gan Cao, augments Qi and harmonizes. Dang Gui, nourishes blood within prolonged Qi deficiency. Chen Pai, regulates Qi so tonics do not cloy. Sheng Ma, raises clear Yang. Chai Hu, lifts the clear and relieves constraint. On an exam, do not memorize the list as isolated names. Link each ingredient to the treatment strategy. The composition should explain why the formula fits its pattern and why a similar formula does not. Now organize the hierarchy. The chief is Huang Qi. The deputy level is Ren Shen and Bai Zhu and Zhi Gan Cao. The assistants are Dang Gui and Chen Pai. The envoy role is Sheng Ma and Chai Hu lift clear Yang. Together, the formula Tonifies Spleen Qi, raises clear Yang, stops sinking and supports containment. A useful board habit is to ask what the chief attacks or tonifies, what the deputies reinforce, and how the assistants control side effects or protect the middle. The target pattern is middle Jiao Qi deficiency with sinking of clear Yang. Look for this clinical picture: fatigue, weak voice, poor appetite, chronic diarrhea or bearing down sensation, prolapse of organs or persistent heaviness, low-grade fever or symptoms worse with exertion. The tongue is pale with a thin coat. The pulse is weak, deficient, or soggy. The board answer comes from the whole pattern, not one symptom. Match the disease mechanism, the treatment strategy, and the tongue and pulse before selecting the formula. Differentiate carefully. Si Jun Zi Tang a Euro simple Qi deficiency without prolapse or sinking. Gui Pai Tang a Euro spleen Qi and heart blood deficiency with insomnia or bleeding. Ren Shen Yang Rong Tang a Euro deeper Qi blood deficiency with marked weakness and Shen symptoms. When two formulas seem close, identify the single feature that changes the treatment strategy. Ask whether the presentation is excess or deficiency, hot or cold, exterior or interior, and whether phlegm, dampness, food, blood, or sinking Qi is the main driver. Safety is part of formula knowledge. Classical cautions include: do not mistake excess heat, yin-deficiency fever, or liver yang rising for sinking Qi. Persistent prolapse, bleeding, fever, or weight loss requires medical assessment. Monitor for edema, blood pressure change, weakness, or palpitations with prolonged use. Modern medication review includes: Zhi Gan Cao can contribute to hypertension, edema, hypokalemia, and corticosteroid interactions. Huang Qi may require review with immunosuppressive therapy. Dang Gui warrants review with anticoagulants. Use a verified product, document the complete medication and supplement list, set monitoring parameters, and refer when red flags exceed the scope of routine herbal care. Formula names do not guarantee identical composition or concentration across products. Finish with 5 board pearls. Number 1. Huang Qi is chief. Number 2. Qi deficiency and sinking. Number 3. Prolapse. Number 4. Symptoms worse with exertion. Number 5. Sheng Ma and Chai Hu lift. The one-line recall is, Tonify the middle, then lift what has sunk. Review the ingredient architecture, then practice distinguishing the nearest look-alike formula. This concludes Zhong Yi Qi Tang. Save this lesson for spaced repetition, and always connect board memorization with safe clinical judgment.